Hello, everyone. I thank you to everyone who have already joined us. And let's just wait for another minute or so for other guests to join. So we'll start really shortly. I would like to ask everyone to mute their microphones if possible, for us to have the most productive webinar. So let me introduce myself first. My name is Olha, and today here I am representing DexLevel. DexLevel is a company that created the product that we are here, that we are gathered here for. So I will be happy to share some like brief information on what is Gaudi and why was it created? And then I will definitely pass a word to our main speakers today, Dr. Arturo Vela and Dr. Virdi. So without further ado, let us start. Just a moment, please.
Let me make you admin. So where are you on here?
Yeah.
Sorry, everyone, I've muted you on my end just because it's a little bit more convenient. Just give me a second, Ola.
Yeah.
There we go.
Okay. Thank you so much. And let me start right away.
What? I'll be through that. No, that shouldn't happen.
Okay, so DexLevel. I already mentioned the name of the company, the developer of Gaudi, and like the main thing that you need to know about DexLevel is that it's a company that creates aesthetic injectables based on high polymer products. So DexLevel as a manufacturer, obviously for DexLevel, the most important thing is science. Science and scientific approach, that's what allows DexLevel to create really advanced products. And that's what allows DexLevel to lead the trend on the market, on the aesthetic market, instead of just following it. So basically, as I'm sure you know that the history of aesthetic market, of aesthetic solutions for the improvement of pigmentation or skin tone is quite long. But, and the skin boosters and skin mesotherapy is what every doctor has in his or her portfolio. However, when we look up the information about the market, we can notice that the interesting trend is that, I'm sorry, let me just mute the new joined guests. So the history of the aesthetic market is related to HA and hyaluronic acid, but the modern trends show us the following thing, that when we Google aesthetic market, like expansion and growth and things like this, you'll see that a lot of articles are actually, their headlines say not aesthetic market. The headlines say anti-aging market. And by the anti-aging market, they actually mean aesthetics. So why is that so? Obviously, because this is showing us what is the main trend that is leading the market now, and that is going to lead the market for the next at least few years. And the most well-known HA products were great for skin moisturization, right? And for like temporary improvement. But we must remember that skin age is not decided by a simple level of moisturization of the skin, right? It's more about the skin elasticity. It's more about the skin tone. It's more about the skin smoothness. So elasticity and skin smoothness is not something easy to recover, right? And a slight effect can be reached by skin hydration. Obviously, that's not what a patient would probably need in the long term. And firmness and skin elasticity should go from the inside. And what I mean by that is that we need to have necessary level of production of elastin. We need to have the necessary level of production of collagen in order to keep our skin beautiful and young. And for those purposes, obviously, aesthetic injectable developers have been working for a long, long time. But as you can see, the history of skin collagen injectables is not too short, right? I'm sure that you know some products and that you've used some products. However, every time when a new product emerged on the market, it didn't mean that this product has replaced the previous one, that this product is a perfect solution. So every time the manufacturers were trying to create something new and to improve some disadvantages of the previous product. So here now we are at the stage of the market where it's always been about the trends, but the modern trend, as we already mentioned, is about anti-aging. Yet it's not just anti-aging, but anti-aging that gives you natural, useful look. So a lot of patients, they do not really want for their friends, family, and people around them to see that they did something, but they do want to keep their youth. And that is the purpose why Gauri was created. So a Gauri is an injectable made of polycaprolactone. You might have heard about polycaprolactone. It's a synthetic polymer, and it's a high polymer, which means that it has really long durability when we compare it to hyaluronic acid or peptides. It's not toxic. It's very safe to the body. And the best thing about polycaprolactone is that it has proven efficacy in terms of increasing collagen synthesis levels. So polycaprolactone being fully biocompatible, as I said, is totally safe for the body as it's being extracted from the body in water and CO2. And it sounds so good. So why haven't aesthetic manufacturers like used polycaprolactone more? Why everyone is keeping on using HA fillers, HA skin boosters? Well, the answer is that polycaprolactone and other high polymers that were used, their main disadvantage was the size of the particles that was used in those products. The size of the particles was quite big. So obviously there was always a risk for vascular occlusion and like all the additional side effects that can arise from this. And because there is no antidote to polycaprolactone, it was rather risky sometimes to use it in the practice. Yet, that's where Dexlava offers you a solution. Dexlava created a unique technology that allowed to liquefy polycaprolactone and make it absolutely safe for the doctor and for the patient to use while keeping its collagen stimulating properties and giving you a great effect once you use it. And now I guess it will be the best to pass the word to Dr. Arturo Vela. He's one of our key opinion leaders. He's an owner of a clinic in Mexico City, and he's been using Gauri for quite like a long time. So it will be the best for him to share his experience and explain how Gauri works. So let me just forward the word to Dr. Arturo.
Hello.
Okay.
All right. So, Olga, I have something that cannot let me see because there's some people that says that it's a waiting room.
Yeah, you'll have to let them join as you're speaking. Unfortunately, that's the
Okay,
thing
I
you'll
will try
have to
just to.
bear with.
Okay, it's just that it's in the middle of my screen, but okay, I'm fine. I can do that. Okay, thank you so much. I'm Dr. Arturo Vela. I'm a medical doctor and also an aesthetic specialist from Mexico City. Yes, as Olga said, I've been working with Guri for a long time, around probably more than 2 years. And I feel very fortunate and very lucky to get to know this product, how to use it, how to inject it, how do you feel it with your hand, because it's something that it's so important too. And of course, all the characteristics, all the science behind, because this is why we are here today. So factors for facial aging, it's not only the skin, what it's gonna be sag and old at the end as we get older. So as we already know, there's foam reabsorption, which will lead to the aging process from the very bottom. And then we will have the muscle laxity and the complements that are the fat pads that will change in its form. Of course, they will get less of fat pads and they will suffer a redistribution. And also another theory is that they say where we talk about the laxity of ligaments, but that's something that hasn't been proved, but it's part also of the aging process. So we come from the triangle of View, as you can see in this picture, where as you are younger, you have this triangle inverted shape of the face, and this triangle will be getting inverted as we get older, as you can see in the second images. So, and when we talk about Guri, we're talking about a product that will enhance the skin. Guri doesn't feel, so we don't have to give it structure as HA fillers or some of others. The structure will work itself in the skin. And when we talk about skin, we have to talk about collagen. So what is the collagen? It's a protein that is the most abundant that we have in the skin. We already know that there's a lot of types of collagen, but the two most important and also important for us to have a difference between the products and what we're going to achieve is the collagen type 1 and the collagen type 3. As we call it, collagen type 1 is a good one, the good collagen, the most abundant, and then the collagen type 3, which is not the bad, but it's the one collagen that we start producing once we have an injury or a wound. So as we get older, after the age of 25, we will start to lose collagen as crazy, and don't even talk about when you're older than 50. So the decrease is around 1.5% per year. And yeah, there's a lot of factors that will affect the production and the loss of collagen. And yeah, yes, these are the genetics, something that you cannot change, and also something that you can modify. It's a sun exposure, diet, and tobacco or alcohol. So yes, we have here one, the other one. You already know the structure. I don't need to be so incisive in the structure of the protein and the amino acids that it has. The thing that we have to understand is that Guri will produce new collagen. So we lose the collagen starting 25, we can get back that collagen that we have lost by the years. And there's two images more where we can see the elastin, the well-organized fibers of collagen. This is something also very interesting to say, because as we age, these collagen fibers, they're going to be deorganized, and they will shorten, and the structure will change very dramatically. So, and as I read in a book, and it is something that I keep with myself, is they say the collagen and the elastin are like the brick and mortar, like for a house. So this is the structure, this is what keep us youth. And yeah, we have other structures, but let's continue with the magic of Goody. Yes, as Olga talked before, the market and the products that we have right now in the market, yeah, they have their own limitations, all of them, and we are conscious of that. So yes, there are products as botulinum toxins that they go straight to the muscle, but it's not going to enhance the collagen. Yes, we have the HA fillers or other types of fillers, but these fillers, yes, they will hydrate, and yes, they will create some collagen, but we have to be very conscious of the collagen that the fillers, HA fillers, will build its collagen type 3, the bad collagen, the collagen that we don't want to produce. So you already know the word. Goody means gorgeous in Korean. And this is the first liquid type form of PCL injectable, which is fundamental for the anti-aging. Why the first? Because yes, we have in the market some products with microparticles. This one is very novel, very easy to use, and very satisfying for our patients. So yes, Goody, it's going to produce collagen, and it's going to give us a really, really nice look regards to the texture, the sun damage, and elasticity on the skin. And of course, with all of this, we'll have an enhancement of the full face, like as a real liquid facelifting. Here we go. So great. So as we know before, polycaprolactone, this molecule is something that is non-toxic for the body. It's a biodegradable polymer, and also it's bioresorbable, biodegradable, and biocompatible. What does all these bio things means? That it's not harmful for the human body. And yes, we're gonna get rid of it through the respiratory system once we metabolize it by complete. So we understand that Goody, it's something different and something unique. And what makes Goody unique and different, it's its patent technology. This patent technology, it's called CESABP. That means collagenesis enabled solubilized active and biodegradable polymer technology. So the scientists in Index Level, what they did is to take the molecule, the polycaprolactone, and instead of attaching a carrier, they did it in a liquid type form. This is how we see the solubilized PCL and how we see another non-solubilized PCL form. So the mechanism of action, once we inject Goody in the deep dermis, Goody gonna start to spread by itself. So this is another advantage. This is something else that I really like about Goody, that if you inject it in one point, it will spread, and that will give us our more uniform and more powerful result. Once you inject it, yes, we start to having this fibroblast stimulation, and through that, we're gonna achieve the new collagenesis and also better texture, face lifting. We have 3 S's for Goody. That are fundamental for us. The first one is spreadability, the second one sustainability, and the third one safety. Yes, we talk about the spreadability, natural spreads in the whole face for a great and better result. Sustainability, when we talk about this part, is that collagen will go to the entire face, and yes, the improvement will be sustainable for around 6 to 12 months. And the safety, it's something very important and something that I really like, and something that you're gonna love too, because it's so easy to use and it's so safe for us as doctors and for our patients. Why? Because this solubilized form, yes, we always have to be very conscious and very to know the anatomy and how to prevent a risk. But with Goody, you have to those side effects. We don't have such a vascular occlusion to get an embolism or more dramatically a facial necrosis. So if we are just doing and being careful, I think you're gonna do it so good with Goody. So here's another part of science. This is very interesting. This is a study that was made in Korea when Goody started, and how after 12 weeks, we see an improvement on the crow's feet in this patient. And yes, we have these images, both the real ones and the ones that have with the Primus software, where we can see that actually the wrinkle is less deeper. This is a study, but also we're gonna see some before and afters, so you can appreciate more about the product. This is another slide from the wrinkle improvement that was 48 comparing to 41 at resting state of the wrinkles, and also an improvement while smiling of 20% comparing to the 13%. In this one, we can see with the control with saline and also with Goody with the Mason stain, how the collagen was increased during 1 to 6 weeks. Another evaluation that was made with a cutometer of the elasticity of the skin, and we see that after the second week, we're gonna have a peak to the 4th week, where we can see and we will have more elasticity in our skin. So this is part of the presentation of how Goody works, how we can use it. And right now we're gonna continue with Dr. Fierity. Thank you so much.
Thank you, Dr. Vela, for your presentation. Is it possible for you to make me the host again, and then I can share my presentation, please? Actually, I can reclaim host, so I think that's worked. Let me try. Yep, that's fine. Thank you very much.
That was a nice move, Dr.
Yeah, I don't know what I did, but I managed to reclaim it. Right. I will just pull up my presentation. Right, guys. So first of all, thank you very much for taking the time. There's quite a fair number of you in this Zoom session, so I won't take up too much long. We'll probably be here for another 20 minutes or so. I know a lot of you have already asked some questions, so just bear with me and I will fire them through, and maybe we can do it verbally rather than typing once this presentation is done. So, before I start, just want to say a huge thank you to DexLevel for allowing this opportunity as well, for me to get very hands-on with the Gory fillers, which I have done now for a fair while. So it'll be nice to give it a different perspective of things, especially here in the UK, which I'm assuming a lot of the participants in the Zoom are from the UK. So a little bit of background just about myself, just on the screen here for you guys to read. And if you have any questions, there is my Instagram handle there at the bottom. So feel free to ask me any questions directly, once this Zoom session is over. Right, so just a very quick recap, a lovely presentation given from an introductory perspective by Ola, as well as Dr. Velo, as to what Gory actually is. So as we heard earlier on, it's Korean for gorgeous. Actually also means gorgeous in the Punjabi language as well. So a very quick recap, it is the first fully liquidized PCL in a syringe. And it is made using patented technology. And one of the other advantages here is it provides a full face effect. And I will come on to what its limitations are, as well as where it sits in the market compared to other things. And I think in very simple terms, as much as I wouldn't like to label it as a skin booster per se, but more biorevitalization. However, in terms of when you are seeing your patients, I guess it does fall under the category of a skin booster. So I know there are already certain brands that are used out there, both hyaluronic acid or calcium hydroxyapatite, and I will come on to their limitations later on. But I do believe all products in the market have a role within the aesthetics industry. But today is going to be about how we actually use Gori, why it is very safe, and what kind of results and outcomes that you can expect. So what are the indications of Gori? Well, we all get patients coming in wanting a full facelift. And let's be real, it's very difficult to try and achieve a facelift without undergoing surgery. So what can we do non-surgically? Well, we've obviously got Botox, botulinum toxin, dermal fillers, we can do threads, laser, etc. However, it doesn't matter what you do in terms of augmentation of the face, there's always one organ, one vital organ that sits covering it all, and that's the skin. So the skin plays a very powerful role in facial aesthetics. And I think a lot of the industry over the past few years has been heavily based around cheek augmentation or jaw lines or profile balancing of the face, which is all very truly well. However, what good is doing all these things if the cover or the blanket cover is showing signs of aging? Now, we do know that collagen production does decrease in your late 20s and will by 1 to 1.5% annually. So what this whole product and the concept and the technology is about is collagenesis, so producing collagen. So if from the age of 25, give or take, we are starting to slowly lose collagen, straight away, we know that we can target the younger generation with Gori, as well as the older generation, because we're all losing collagen. The main indications are going to be things like fine lines and crepey skin. So a common question that I get asked is, well, where can this product be used? Well, my answer is quite simple. Where do we have fine lines, wrinkles, and crepey skin? It could be on the face, it could be in the neck, the hands, the décolletage, the abdomen, the thighs. You get the picture, right? So it could be everywhere. Things like dehydration and the skin tone, as well as the texture, all these things can be produced by basically, in inverted commas, tightening the skin. But actually what we are medically doing is inducing collagenesis, which is what gives that tightening effect, the hydrating effect, and the lifting effect that we all so much desire. The contraindications, and I like to get this out of the way sooner than later, things that should be kind of fairly straightforward to you guys. So pregnancy, breastfeeding, known hypersensitivity, anaphylaxis, and certain immunocompromised or systemic conditions, whether it's uncontrolled diabetes or if it's things like cancers. The first point here and the second point, so blood thinners as well as non-steroidals, personally, from experience, I wouldn't say these are an absolute contraindication, but more so a caution, especially within capable hands. With regards to the safety and the efficacy of the product, from a complications perspective, and I know somebody has already asked the dreaded question, what can go wrong, or can anything go wrong? And Dr. Velo has got his vast experience with this product as well, and I'm sure he'll agree that no significant adverse events have been reported with Gori to date. Now, that doesn't mean that nothing can or will ever happen, but to date, to have that kind of data to hand is very reassuring. As for complications, it's something I will touch base on later on in this presentation. We've also heard that it is biodegradable, biocompatible, which means it is non-toxic and non-teratogenic. So it's an ideal combination of what we are wanting. And there's no need to prepare the product either. And that's a very important point if you are using certain collagen stimulators, namely PLLA, Sculptra, also some of you may know it as, where you may need to ferment the product and prepare it usually 24 to 48 hours prior to injecting the patient. So there is no need from that perspective. It comes in a ready-made syringe, so very simple, very safe, and very effective. We have touched base on the 3 S's, spreadability, and I'll talk about this later on as to why it is so powerful. And the way I'm going to try and deliver the rest of this presentation is I will try and compare this to other, in simple terms, skin boosters out there, because we have heard things of like Profhilo or Profound or Teoxane's Redensity 1, Sunakos, etc. So I'm going to try my best to try and compare these with things that we are currently familiar with. But coming back onto the 3 S's, spreadability. a single injection has the capability to spread quite a large diameter, and you'll see our injection protocol later on. Sustainability, and what we mean by this is the duration of results. So another common question, once we use GORI, how long does it last? And I always say, well, how long is a piece of string? It's not about how long it lasts, it's how well can you maintain the treatment. And again, I'll talk about the protocol in upcoming slides. And safety, which I have just touched base upon, no significant complications to date. And I know the dreaded question is, can you have a vascular occlusion? Again, I'll leave you guys just pondering with that thought for a second, and I will come on to that shortly. So the injection protocol, to keep it simple, there's three. There's the eye protocol, so periorbital rejuvenation, the general protocol, and the enhanced protocol. In a nutshell, the enhanced protocol is the top two pretty much, put together, and I will show you how. Coming on to the first protocol, which I will show you next, the eyes. They often do say when you walk into a room, one of the first parts of the face that you're going to see is the periorbital region. Now, the eyes are very powerful with regards to aging. They give a lot away, whether it's happiness, whether it's sorrow, anger. And at the same time, from an aging perspective, it is very challenging to treat. It's very difficult to try and treat lax skin of the upper eyelid or the lower eyelid. But the good thing that we have with GORI is spreadability, which you will hear me say quite a fair few times. And what I mean by this is there are certain injection points of the face, which I'll show you on the next slide, which will allow this product to beautifully disperse itself throughout the dermal region into areas that we want it. Which is why that we are trying to promote this as almost like a full face effect from the 10 base injections, which you'll find in the general protocol. So in terms of how to inject the eyes, so what you have here is a standardized and safe protocol. So what we have here is the lateral canthus. I would like to think you can see my mouse moving around here. So we've got the lateral canthus, and it's similar to doing botulinum toxin for crow's feet. The first injection is usually 1.5 centimeters away from the lateral canthus. So you want to visualize or ideally mark this point with a white eyeliner. And then not from the mid-pupillary line, but from the lateral limbus, which is known as the outer part of the iris, we want to work around 1.5 centimeters down. And then if you almost visualize a curved region, anywhere here, it is very safe to inject. Now, if they have very fine lines and crepey skin higher up, it would make sense injecting in this region. Or if they have fine lines and crepey skin in the mid-face over the zygomatic region, it might make sense to inject here. But as a general effect, I tend to inject at the apex, which is right in the middle here, and we are going to put half the syringe. So that will be 0.5 cc of GORI intradermally in this one injection. And what you will notice is it will spread beautifully into the periorbital as well as the mid-face region. In terms of things like prepping the patient, numbing creams and types of needles, etc., I'll come on into a few slides where I go through some recommendations. This slide does look like quite a handful actually, but I will go through this quite simply with you guys. Now, the eye protocol involved half a mil or 0.5 cc as one injection on each side. Whereas when we're doing the general protocol, every injection, so there's 10 injections in total, 5 per side, every injection is 0.2 cc. Now, the first injection is at the level of the mid-pupillary line. And what I tend to do is I palpate the supraorbital rim, which is usually where the eyebrow sits, and about 1.5 centimeters or a finger width up would be my first injection, 0.2 mil, and it will be intradermal. Remember, we are trying to inject into the dermis because we want to stimulate fibroblast activity here. In trying to inject deeper, i.e. in the subcutaneous layer, theoretically will be not of maximum value. The second injection is going to be from the alar, so which is the nostril area, so the lateral alar. You're about 2 centimeters lateral or away from the nostril, and again 0.2 mil intradermally here. Your third injection is where I would like to describe the lower part of the earlobe or the lateral element of the face. You want to work 2 to 3 centimeters inwards, and again 0.2 cc intradermally. And then your fourth injection is in between points 2 and 3. However, it's in the horizontal plane of the oral commissure. So that will be point 4. And the final point is what we discussed in the previous slide, which will be anywhere in this region when it comes to periorbital rejuvenation. However, it's 0.2 cc and not 0.5. So in this patient, we would need 2 syringes because we'll need 1 syringe per side of the face. The enhancing protocol is...
Gurnan, can I just interrupt you? I think someone is in a waiting room. Could you just please have a look?
Right, sorry guys, give me a second. View admittal. Right, that's fine, thank you. So this is the enhancing protocol. So I thought I'd said something wrong there. I was about to get told off. So this is the enhancing protocol. And here what we have is a combination of the eye protocol as well as a general protocol. So here we are going to be injecting 0.5 cc around the eyes. So the lateral inferior aspect of the periorbital region, anywhere here, we would inject 0.5 cc, and then you still do the remaining 4 points on this half of the face with 0.2 cc. So this will be the enhanced protocol. In terms of how often we need to do these treatments, now these are guidelines based on clinical outcomes by both the manufacturer, well-established dermatologists and plastic surgeons and aesthetic clinicians that have been working with Dexlava. So essentially we need to do 3 treatments and they will be done at 4-week intervals. And then afterwards, we would want to repeat this at month 6, or we may decide to repeat this at month 12. And I guess here, this is the importance of assessing your patient on regular follow-up, and then that would determine in terms of how well they're doing with regards to collagen and the aging process, etc. Is there any harm in sometimes doing 2 in the initial? Probably not. Is there any harm in doing maybe 4 sessions in the initial? Again, probably not. It's going to be quite difficult to try and overdose on Gori. And this is the importance of, especially very experienced people, practitioners. We often say, just assess your patient in person and you can then decide your plan. But as a general rule of thumb, we want 3 sessions, 4 weeks apart, and then we can do a maintenance session every 6 to 12 months. Key recommendations. So a 30 gauge needle is ideal as the bare minimum. You can actually go smaller, 31 or even 32 gauge. So this just goes to show, how easy this product is to inject. Now, there are certain products out there on the market. There's a very popular skin booster, which actually comes with a 29 gauge needle, and it's quite difficult. It has a very thick extrusion force. And in the previous presentation, Dr. Arturo Vello showed us a study, I'm not sure you quite saw it, but essentially there was a study that was done injecting Gori and injecting saline, and the extrusion force and the results were very comparable. So it's a beautiful product to inject, hence why you can inject with a very fine needle. Topical anesthesia is recommended. So whether you're using LMX or EMLA, so a very small layer into the area that you're going to inject, is advisable. All you need to do post-treatment is gentle massage. They may have 0.2 cc of the product build up. You don't need to do anything vigorously. You don't need to make them extremely red. Just gentle massage after each injection, off they go. And muscle expression will allow the product to spread beautifully itself without you having to do much. We do also recommend an antihistamine pre-treatment, usually about 1 to 2 hours pre-treatment. And the basis for this, and I know there might be some raised eyebrows on this, but the basis for this is quite simple. Gori is still a relatively new compared to other collagen stimulators out there on the market. And so given that we are still fairly in the early stages, we just want to promote the safety of this product. Now, in terms of what can happen post-treatment, I will talk about in the next slide. It can be used in combination with other things, namely Botox or skin boosters. Now, when it comes to dermal fillers, we either say use a dermal filler first, 1 month prior to treatment with Gori, or use it a month after treatment with Gori. And I guess the main reason with this is, well, we're all quite hot on complications. And if there were to be a complication, is it going to be a collagen stimulator? Is it going to be cross-linked hyaluronic acid. What is it the patient is reacting to? What is it the complication that you are presented with? So I think in terms of safety, as well as just clinical assessment to see how well the patient is doing, I think it would make sense keeping dermal fillers, which are cross-linked HA, and Gori apart. However, when it comes to Botox or skin boosters, given Botox is injected in a different plane, it's intramuscular, there's absolutely no contraindication there, so it's safely used with Botox. And skin boosters, again, will probably just act as an adjunct and provide extra vitamins and minerals and antioxidants if used in conjunction with Gori. So what can you expect post-treatment? So, you know, they're not going to wake up the next day and be 10 years younger, you know, if only that was the case. You know, these results will take time to be seen. Now, normally in Caucasian, so in white skin, you may expect to start seeing results anywhere between 1 and 3 weeks, and then maximum results after about 3 months, once you've had your full course of treatments. In higher Fitzpatrick scale skin types, the results initially can take a little bit longer, maybe around the 4 to 6 week mark. But ideally, we do still recommend that you have your 3 sessions. In terms of what you can expect post-treatment, so pain, I guess you've got a needle that's, you know, being introduced into the face. You're penetrating the main barrier being the skin. There is always going to be an element of pain. What should we be watching out for? Pain out of proportion. So any excruciating pain, that's not normal. And that's something that we need to just reevaluate. Bruising, this can happen with any needle that is being introduced into the face. It's not the end of the world. It will settle after a few days. This is why I said earlier on, just take a lot of caution if your patient is on blood thinners, aspirin, anticoagulants like warfarin, rivaroxaban, etc. Erythema, which is redness, and edema, which is swelling. Again, these two can occur. Usually they occur simultaneously. There is something I have missed off this list, which is itching. Now, erythema, edema, and itching, so redness and swelling and itching, can occur usually after 7 to 10 days. Now, this is actually quite normal from an inflammatory response from the body. Now, the body isn't reacting to Gori, the product. It's actually reacting to the whole process of collagen production within the area, which is why sometimes the patient may be red or slightly swollen at the injection site 7 to 10 days post-treatment. Again, nothing to worry about. It will settle in due course. Allergy and hypersensitivity, I guess this is, again, with anything. Infection, very rare. As long as you take your usual precautions, you'll be absolutely fine. If this were to occur, again, you want to start them on antibiotics as per your local protocol. Lumps and nodules. Now, I have put this on the list here because I think in aesthetic medicine, and I'm sure Dr. Villa will agree, nothing is impossible, which will make my next couple of slides quite interesting, actually. It's very safe to use. There's been no adverse events, as I said earlier on. However, you know, anything can occur, like I said, but it's very unlikely that you will have lumps and nodules with this product because there are no microparticles within Gori. And again, I'll talk about microparticles and the whole concept of having a fully liquid PCL and its benefits later on. So complications, they are rare, and as I said, so far unreported. Prevention is always better than cure. And I guess what I mean by that is knowing your anatomy. Nothing is going to make your patient safe other than the injectant. So whether you're going to give me Gori, whether you're going to give me, you know, PLLA or CAHA or HA, the safety is always in the hands of the injector. So the main thing here is learn your anatomy. Now, I'm not going to be giving you an anatomy lesson today. I think that's beyond the scope of this presentation. However, prevention is better than cure. Now, in terms of vascular occlusion, now this has been asked by somebody, I believe, earlier on in the chat. Now, it is extremely, extremely unlikely that that is going to occur with Gori. However, if you were to now take Gori and find, for instance, the supratrochlear artery or the supraorbital artery, and with an ultrasound, you directly go into this and you inject quite a large amount of product, you are going to cause a form of vascular insult. Now, to put things into perspective, you can also have a vascular occlusion with PRP. I'm sure some of you might even be quite surprised by that. So it doesn't have to be a dermal filler to have a vascular complication or a vascular compromise situation. It's unlikely you're going to have external compression because it's like saline. It doesn't have that G prime where it's going to cause that external compression. So you'll have to inject quite ruthlessly or have no insight into clinical anatomy for you to be intravascular and then inject a ridiculous amount of the product and then cause a vascular issue. So the reason why I will always say it is not impossible to have a vascular occlusion is so you don't become complacent when injecting such a beautiful product. It's phenomenal to inject. The results are phenomenal, and your patients will also look phenomenal, provided you understand the relevance of injection and clinical anatomy. So prevention is always better than cure. Some anatomical considerations, needle versus cannula. And there's a reason why I put this in here, because I know there's some of you injectors out there that would prefer the cannula. You know, some of my colleagues, very experienced in the industry, and they just love using a cannula. And I guess if you absolutely have a fear of needles, I'm a needle guy, by the way, I use needle everywhere, but if you have to use a cannula, I guess there's nothing stopping you from using a cannula. You would have an entry point. I guess your entry point would be somewhere lateral in the face. You would aim immediately with a 25 gauge cannula, but just be aware that you are going to be subdermal. There's no way you'll get a cannula and be intradermal. So it begs to question, how much of the product would you be fully maximizing to its full capacity? We will not really know. So ideally, you want to inject GORI intradermally. Aspiration, I've been doing facial aesthetics for about 7 years now, and I've never aspirated ever. Again, I guess, you know, everyone's going to have a different viewpoint. This is not a debate session regarding this. If it's something that you do in your clinical practice, please do carry on. Please do not stop just because I have said this. Again, I'm very passionate about complications, and if there's something you want to talk to me about, you can always speak to me afterwards. However, if you aspirate, please do. But do note that GORI, 1, has a very low extrusion force, again, comparable with saline, and 2, it is to be injected intradermally, which you will be in a very safe plane. So provided you stick to the injection protocols, you probably don't need to aspirate. But again, if you do, please do. And the depth, the most important thing when it comes to any injectable, not just GORI, is the depth of your needle, because we have varying vessels in the blood vessels. For example, facial artery inferiorly down here is deep. As it works its way up, it becomes superficial. Same with the supraorbital and supratrochlear arteries. They are deep for a centimeter or so above the supraorbital rim, and then they take off and run superficially like an aeroplane. And again, you know, as these blood vessels are running up, you know, higher up into the forehead, we just need to take care of what depth we are injecting GORI into, especially in larger volumes. So let's compare this to HA. So hyaluronic acid, we get it cross-linked, we get it non-cross-linked. I'm not really fussed about it being cross-linked because that's your dermal fillers. We're not talking about dermal fillers today, but non-cross-linked. So let's pick an example. I'll talk about Profhilo. Okay, and I think that's quite fair for me to talk about Profhilo because it's something that we've all heard and that we all use. And as I said earlier on in this presentation, for you Profhilo lovers out there, is that every product has a role on the market. So I'm not here trying to say never use X, Y, and Z. I'm just trying to use it as a simple comparative. There are limitations with Profhilo, and I guess with your BAP technique, you are limited to the lower 2/3 of the face. At the same time, you've got the mechanical issues, for example, the extrusion force, the pain element of this, and 3, the clinical outcomes. And what you'll find with PCL, namely GORI, is that we have a longer lasting collagen producing process. So again, we've got a protocol for the upper third of the face. So it can, sorry, there's people joining this webinar, so I'm just letting them in. So yeah, so there is, the GORI protocol covers the whole face. As I said right at the beginning, it's the full face effect. So a single injection, for example, here, 0.5 cc here is enough to rejuvenate the periorbital / the middle face, the mid face, in terms of collagen production and just skin rejuvenation. So it's very powerful in terms of its spreadability. We know the sustainability, which is 6 to 12 months, and we also know that it's very safe. Remember the 3 S's. So with regards to Profhilo, it's a full face approach, not just a lower 2/3 face approach. And it's a beautiful product to inject. Again, low extrusion force, comparable with saline, and we have very favorable clinical outcomes, which my colleague, Dr. Velo, will show you shortly. Compared to other collagen stimulators, now, I'm assuming there's a lot of you here from various other countries as well. There's a huge part of you that are here from the UK, obviously. And I'd like to think, I'd happily stand corrected, but collagen stimulators aren't necessarily a big thing here in the UK. Again, just from a comparative perspective, I will name Sculptra, which is PLLA. I will name Alonce, which is also another PCL, similar in ways to Gori. And we also have things like Radiesse, which is a calcium hydroxyapatite. Now, each of these in their own right have a role in the industry, but from today's perspective and my experience with all these products also have limitations. There is no need to prepare Gori. It comes ready-made in the syringe. You attach your needle and you inject away and you aim for that full face glowing outcome. So there's no need to ferment the product 24 hours prior hand. In terms of excess volumization, now, for some of you, volumization might be a very powerful thing, and especially when it comes to the mid-face. However, if you think of it logically, do we want excess volumization around the periorbital or the perioral region? No. Now, with other PCL products on the market, like Alonce, they contain 30% microparticles, or PCL, if you like, and then they have 70% CMC carrier gel. And the fact that it has microparticles in it, as well as the CMC complex, means that you will get initial volumization, and then on top of that, you get collagenesis, which means that there is a risk of excess volumization, which isn't always an ideal scenario in certain parts of the face. Again, having microparticles within certain products will also increase the risk of nodules and granulomas. And if you've ever had one of those, I'm sure you'll agree that can be quite tricky to try and get rid of. So the advantage that Gori has compared to other collagen stimulators on the market is the fact that there are no microparticles. So you're not going to get excessive volumization, as well as the element of it being fully solubilized. Therefore, you're going to get great spreadability, and we can target the whole face, not just certain aspects. Right, thank you very much for listening to me ramble on there. I will stop the slides, and I know some of you have got some questions. I will hand over back to Dr. Artero first, and I guess we will address all the questions once he's gone through the before and after pictures. I think it's only fair. Right, so whilst we wait for Dr. Velo, rather than the awkward silence, I'm just going to have a quick look at the chat box, see if there's any questions. So Ray, you've asked if I can show you the eye protocol again. Yep, no problem. I can go through that once we've been through the before and after pictures. Alex, you're asking how much I would charge. Again, the financial aspect of things we can talk about towards the end. Amne, you're asking if it's the same rating as Profhilo or the 8-point lift, or is this more like a 10-point lift? We're not actually trying to lift anything in the face here. What we're trying to do is induce collagenesis, which will tighten the skin, brighten the skin, hydrate the skin, which in turn will give that so-called lifting effect. But there's nothing that really will actually lift the face. Yes, you can use dermal fillers with high G prime, which can lift the face to an extent, but dermal filler will just only reduce as time goes on, whereas with Gori, we're producing collagen as time goes forward as well. So there's a different advantage, and it's hard to try and do a direct comparison with dermal filler and Gori, because you don't really put cross-link dermal filler in the dermis. So the indications are two different things. Therefore, it's not fair to compare. Somebody else is talking about finances and money, etc. Alex, I think you said you want this doing. Yeah, I'm always looking for models, by the way. Right, somebody's asking to show videos because you're anxious about injecting 0.5 cc in one area, Lisa. Well, 0.5 cc actually isn't a lot of product. To put things into perspective, I've actually put 25 mil of cross-linked dermal filler in one patient's face in one sitting. So just to put things into perspective, 0.5 mil isn't a lot. And to try and put things into perspective, if the tip of the needle is intradermal and you have a product that has spreadability comparable to saline, it will disperse almost within minutes. If by any chance there is a little bit of redness and swelling, by the time the patient gets home, they're obviously speaking, talking, laughing, etc. It will have dispersed beautifully itself. And there's nothing stopping you from doing a gentle massage, a bit of arnica cream or aloe vera, etc. They're absolutely, I can understand the anxiety when it comes to injecting. However, you know, the safety profile is second to none with Gori, and 0.5 mil really isn't a lot of product. Hi, Selma. It says on the Gori website, it can only be used on the face. Is this correct? I guess this is true. So the protocols that you have seen are for the face. Now, as I said to you earlier on, whether I get told off by Lorena and Ola and Dr. Bello, I don't know. But I guess off-label, you know, we have skin all over the body. We are losing collagen all over the body. So provided you have the right indication, I guess off-label depends on your own clinical expertise and how confident you are in injecting. But essentially, we are going to be intradermal. So if you ask me, you are going to be safe all over wherever there is skin. Hi, I think that says Aina. Sorry if I've said your name wrong. How deep do we have to inject? Intradermal, just like you would with a skin booster. If you use a very sharp needle, like a 30 gauge needle, as soon as you penetrate the skin, you get a very subtle give. And that's how you know you are intradermal. And if you will raise a small bleb in the skin, again, you know you are intradermal. If you're injecting and you don't see anything, you're likely to be subcutaneous. Hi, Maggie. What will happen if I inject into the wrong layer, too superficial or too deep? Well, if you inject too deep, you're going to be subdermal, so in the subcutaneous layer. If you inject too superficial, you are going to be in the epidermal-dermal junction. And I guess what will happen is you will still get the results. However, it will take longer to see the result. And the reason there is quite simple. It's not cross-linked. Therefore, you're going to have what we call a 3D effect of Gori. So it will not only will it spread horizontally, but it will spread up and down as well. So provided you're in the wrong layer, I would have other things to worry about, such as complications. But in terms of clinical outcomes, yes, you might waste a small amount of the product. However, it will have a 3D effect.
Dr. Verdi, could you please forward the hosting to Dr. Ardo again?
I think I already have.
There was a slight internet disconnection, so you have to do it once again and find him in the list.
It doesn't allow me to. I think he might be host.
It says that Dr. Gordon Verdi is the host right now. So
let me have a look.
Maybe another connection, another device that you're connected with right now.
Okay, I've reclaimed host, so let's try it this way. Sorry, Dr. Velo, I'm taking your fame away right now. I'll make you host once again.
And while we're doing that, I'll just probably make additional comment on the previous question regarding injected into a different level rather than dermis, deep dermis. As actually Dr. Verdi is absolutely right, like Gori spread. So in any case, the product will be located in multiple layers. But first of all, why the recommendation is deep dermis, as already was mentioned by Dr. Verdi, fibroblasts, right? The most of them are located in dermis, and that's what we're trying to aim, stimulation of fibroblasts. And in case of superficial injection, and sometimes we get questions from doctors that work with our product, can we inject it as a mesotherapy into the superficial level? It is possible to some extent because the product is spreadable, but the thing is you have a very, very strong skin tissue stimulation. So in case of superficial injection, again, as Dr. Verga mentioned, here we have a higher risk of body response. So swelling, redness is more likely when you inject it superficially. That's why patients, even though it's going to go away itself, there's going to be no problems, but patients would rather not have those complications whenever you can avoid them. So just inject it into the deep dermis and you'll be fine. Okay. We had a presentation, now we lost it again. Unfortunately, the internet connection gives us some troubles, but okay, we have it back now.
Yeah, I'm back. Okay, so sorry, the connection was broken or something. Okay, so just for the medical cases, I'm going to show you some of them and what I can achieve with all my patients. So this one, we can see the before treatment and after 3 sessions of 4-week interval. We can see if you look at the middle part of the face, you can notice the improvement of the skin texture, the skin laxity, and of course, the replacement of the malar fat pads. You can see already also part of the nasolabial folds that they look less deeper, and also the jaws, they look less saggy. And we have a full reshape of this patient's face. I'm gonna show you the 6 months, after 6 months, how we still have this enhancement of the skin. And also here you can see another angles before, after, and 6 months after the treatment. It's very interesting how many patients can say to you like, hey, I was with my family and they told me you looked better. What did you do to your face? They don't really know. But because it's the natural enhancement of the skin. Here's another one of my patients. Always, I really like the 3/4 photography because here you can see both cheekbones. You can see the left one and you can see how it's higher and the skin texture looks so much better. And for example, with her, as Dr. Verdi said before, in Caucasian skin, it's very easy to lift. It's very, very normal for Caucasian patients. But when we have this mix of culture in Mexican skin that we are mixed, so it's not hard, but we use more quantity for the protocols. Another slide. Here another case. You can see the wrinkles in this patient, how they look less, actually more softer, the skin. Here around the eyes and the general shape of the face, how it's everything repositioned. And this one I really like so much because you can see how the wrinkles are less deep. And this one you can see the part of the jowls and nasolabial folds. And this one is one of the most recent cases. It's so beautiful, the result. As I told you, Caucasian patients can have a result more faster than other types of skin. And of course, here you can see the development of the infra eye area and also the malar area, the cheek fat pads, and the skin quality in general with this patient. She's great. So yeah. As I said, European skin, I think it's very great to use. Asian skin, if you're doing a Latino skin, yes, it's great, but probably you will use more sessions or more product in one session. So those are some of the cases. And if you have any question, I'm open to hear you all.
Thank you very much there, Dr. Vella. So hopefully, just finishing off on my presentation there, guys, you've seen some remarkable before and after pictures at various clinical lengths, both immediately after treatment, 1 month, as well as later down the line. And we've obviously shown you both male and female faces. Again, the main indication here is full face rejuvenation of the skin, fine lines, crepey skin, laxity, etc. So, it's new, it's innovative, it's very noble, and it's the first of its kind. And with the safety of profile that's attached, I think is unremarkable. I've always said, and I'm very privileged to be speaking at various conferences, that, and I'm sure Dr. Vella will agree, that collagen stimulators, they seem to be for the daring, especially here in the UK. Most people tend to use hyaluronic acid based products. Why? Because you could dissolve it with hyaluronidase. So collagen boosters and stimulators, they tend to be reserved for those that are either extremely experienced or so forth. But to have a product that doesn't have any microparticles, yet still has the ability to very powerfully produce and stimulate collagen, is second to none and remarkable. So strongly advise you definitely to get hands-on, and we'll be very excited to see both before and after pictures, and you can forward them to us and Ola, and we can take it from there. So anyway, any questions that anyone has? I feel like I'm taking over this webinar. I'm not sure if I should or not, but yeah, if anybody has any questions for me, Dr. Vella or Ola, then please fire them away. Regarding the protocols, I would like to say that we can possibly email them out to everyone. So those of you that have made notes, well done. I was only joking earlier on when I said you have to make notes. But yeah, so if anybody has any questions, that would be good. Right, somebody is asking what injection angle. What would you say, Dr. Vella? What angles do you tend to inject at to be safe?
I think between 15 to 45. I think that's the best thing. I used to do at the beginning at 90 degrees and heating the subdermal layer, the hypodermis. And yes, the result is good, but as you said, doctor, it is better if you inject it as a skin booster. So it's what we have noticed. As you can see in the last picture, she was like this with this protocol. Well, many of them, but yeah, it gives very results. So I call it now collagen boosters. So I think it's a future for aesthetics.
Yeah, definitely. And I think, we're all used to things like Profhilo as an example, which I do think is a good product. But I think, it is about time that we have other things that are, totally different concept, that have less limitations, and it generally is for a full face approach. But hopefully that answers your question as to what angle. So if you're going to go intradermal, you do want the needle to be quite shallow. So usually anywhere between 15 and 30 or 45 degrees is absolutely fine. And I normally find it's just the bevel of the needle goes in, and that usually is more than enough when doing these injections. As always, do take care when injecting the upper third of the face, which is the forehead, given it's a very vascular area to inject. Out of curiosity, just for my own learning, what gauge needle do you use? Because I've been using 30 gauge, and maybe I should try using something smaller. What's your experience on this?
I do the 30, but I also use this one that it's called invisible needle from the laboratory, and I think it's like 33 and almost 34. It's something like that, and it's good. I mean, it's very tolerable for the patient because it's flexible and very tiny. But I think between 30 to 34, it's great to use them.
Brilliant, perfect. Yeah, no, like I said as well, I've used a 30 gauge, and it's like I'm just injecting tap water, so it comes out absolutely amazing. And So yeah, we can also use the invisible needle, which are not easy to get hold of, but they are quite small, 4 millimeters long. So again, from a complication perspective, it's very unlikely that you're going to be into vascular territory. Somebody has asked about a consultation form from Gauri, and I will let Ola answer that question shortly. But very quickly, somebody's also asked, where can we get this from? And we've got a list of emails now, so the distributors, etc., are liaising with the pharmacies in the UK. So everything will be emailed out to you guys as to where you can source this product from. But I'll let Ola answer the question regarding if there's any consent forms, basically.
Obviously, we do offer necessary materials. So if there is a doctor who works with Gauri, the doctor can always ask their local distributor to provide necessary materials for the procedure.
Yeah, I think if you're lucky, I might ask Dr. Velo very nicely. He'll send it to me, and then I'll send it to everyone. So I think we could do something like that.
Totally.
Sure.
And yes, it is CE approved. I think a few people have asked that. I don't know what kind of people we would be if we're launching it in Europe when it's not CE, but hey ho, it is CE approved. Yeah. Any other questions, anyone? Right. Okay. I'm not going to answer any more questions now, otherwise I'll be here all night. But I will say thank you very much, Dr. Velo. I think you did an amazing presentation, and Ola once again from Dexlava allowing the opportunity. So thank you everyone as well. And if you have any questions, ping me a message on Instagram and I'll get back to you guys.
Thank you.